I'm going to call the meeting to order since it is 2 minutes after 1 and it looks like most of us are here.
Channel 2?
Channel 2? 10:02, thank you. Do we have...
You said it was 2 minutes after 1.
She dropped the zero.
I looked up there. Who's taking notes this morning?
Me and Cody are.
Okay. All right. I'm Joe Bradley. I'm the chair, and there's a few faces here I don't recognize. So I don't know if everybody wants to go around and introduce themselves. Call. That's your job.
Yep. Anthony.
I'm here.
Joe.
I am here.
Mark.
Mark is excused.
Excused. Okay. Jennifer. I'm here. Denise. I'm here. Harry.
Nobody's heard from
Okay.
Tim.
Tim.
Nobody's heard from Tim.
Martin.
Here.
Jeff.
Here.
Gina.
Yay. Okay. So we have a quorum. So has everybody had a chance to look at the agenda? Pardon me?
Oh, I'm sorry.
Am I okay?
Yeah, you're
Okay. All right. Has everybody had a chance to approve the agenda? And is there anything that somebody needs to edit? Okay. Do I need a motion to approve this agenda?
I move.
I second.
Okay. All in favor? Ann?
Everybody.
Okay. We open the floor now for public comments. Is there anybody that has anything that they would like to share with us? Anybody on the board that needs to say anything? Okay. Hello, I'm sorry.
That's okay.
Sure.
And can you introduce yourself, please?
Yes, of course. Jolene Treadaway, Redwood Community Services. I'm the Chief Clinical Officer, and I'm here representing Victoria Kelly today. I just wanted to share that currently RCS has 192 children active and 275 adults, and we have 2 children and 5 adults in referral, and 30 children and 26 adults completing assessment. And in our crisis services, we have 107 children and 561 adults active in crisis aftercare services. And we have currently served 275 adults in crisis and 310 in outpatient services, and 30 youth in crisis outpatient and 244 in outpatient services since the beginning of July. Our primary service locations are Ukiah, Willits, Fort Bragg, and Redwood Valley, with the bulk of our clients being served in Ukiah. And I did want to say that we have a lot of openings for service for children and adults on the coast. And so I wanted to put out to the board that, if there's a need, we have space. And so I wanted to say that. And trying to think if there's anything else. Oh, our crisis residential currently has 8 residents, and we served 10 individuals in July. And trying to think if there's anything else. And I think later this morning I'm going to talk about our expansion of our SUD services. And that's it. So thank you all for your time. And I think I'll pass it.
Anybody else?
Good morning. I'm Brian Erickson. I'm the Operations and Development Director at Tapestry Family Services. Did want to share an interesting thing that with regard to the volume of people that we've been seeing in comparison to previous years. Looking at the fourth quarter, so April 1st to June 30th of 2024 compared to 2025, we saw an increase of 262% of the referrals that we had received compared to the previous year. With that, our services have expanded and we have grown tremendously, including providing services over along Fort Bragg. So now we have offices in Ukiah, Willits, and Fort Bragg, and we provide services to outlying areas as well in the North County. And we continue to look at how we can open up and expand our operations to the entire county. So we continue to do that with recruiting. We have 3 new therapists who are starting within the next 35 days. So our group of therapists is growing. The services that we're providing are expanding. And also, I wanted to let everyone know that previously we had the HEROES program. We talked about that a lot. We are in the final rounds, the interview round for a private foundation funding that would fund that program for 3 years. And that interview is in the next, I think it's next week. So we've gone through numerous stages of the application process, and we're hopefully going to be one of the ones chosen for 3 years of funding to continue the HEROES program. Any questions I can answer? Thank you very much.
Hi, I'm Sarah with Anchor Health Management, Sarah Walsh. I'm just going to highlight some things. We have moved our meds management office to the new building on 531 South Orchard Avenue. So our meds management services are now held over there. That's been as of August 14th, I think. We did staff the front desk at the old building so that if clients came to the old building, we could navigate them to the new building. But we really didn't have too many people coming to the old building, so we will be officially out of the old office by the end of this week. With the MHRC, we are still working on construction, so that part of, we don't have occupancy, obviously, for the MHRC wing, nor do we have it for the admin. So all of our staffing and stuff are either working remotely or working in the clinic office until that all finishes up. But we're almost done. We will start posting jobs on Indeed and on our website for anybody that's interested in the MHRC, any jobs at the MHRC. And then we've already started contracting or reaching out to do contracting with counties. And we've already started the referral process with Mendocino County so that we can have clients in as soon as we open. Anybody have any questions? Yeah.
Do you have an expected open date?
Well, it keeps getting pushed out, so sure, last March. I don't know. I don't know if Tim has or Dan have said anything to you.
No, the last update was
September.
Turnaround, it's something
Yeah.
else, yeah.
Yeah, so September is the last one I heard, but I'm pretty sure that's not happening. Yeah.
Thank you. Sure.
It's a moving target.
Hi, I'm Queen Novotny. I'm the board chair of NAMI Mendocino. We are primarily a volunteer organization. We do education, advocacy, outreach, support. We have been invited to NAMI has a state conference in October 16th and 17th in Sacramento. We have a panelist of 6 Native teachers that have gone through our family-to-family course and are becoming leaders in their tribes for behavioral health, further support and teaching. And we will be working, we've been invited to speak on this and how to bring the NAMI curriculum into different cultures in a respectful way. Thank you.
Anybody else? Nope. And we're going to go forward. We are having a couple presentations today. The first will be Fort Bragg Police Department. Thank you for being here.
Good morning. It was my understanding that I was invited here to give you an overview of what Crew does. I'm not sure 25 minutes is going to be enough, so I'm going to go for about 15 and then leave 10 for questions because I'm sure some of you have them. Who am I? I got into this behavioral health portion and homelessness issues back in 2016 when the Hospitality Center went against the city with the ACLU when they acquired the center, and there were some concerns about how that facility was being used, was how I first started really dipping my toes into that. The city walked away with that with 26 conditions or 23 conditions on the hospitality house about how they were ran, some different restrictions we could put on them. And what I found with that was that there were some effective solutions out there for some of the issues we dealt with if we were willing to be innovative about how we approached them and equitable. With that going on, that really kind of got me going that law enforcement, a badge and a gun is maybe not always the necessary thing to fix a lot of the problems that are going on out there. So today what I'm going to present to you, I'm going to talk to you about the Care Response Unit, the umbrella programs that are underneath it. I'm going to give you some statistics, quantitative statistics, some qualitative statistics, and some purely anecdotal stories. I will tell you, I'm not a fan of quantitative statistics. Those numbers of how many people we touch, how many pamphlets we handed out, how many times we talk to a client, I think that they serve a purpose somewhere, but if they're not fixing a mission of something, I don't think they're worth a whole lot to me. I'm also going to talk to you about what the future in the next 6 months and the next 2 years looks like for the Care Response Unit, and again, I will leave some time for questions. So the Care Response Unit came out about 2020. Around that time, I worked with Supervisor Norvell. He came to me, a grant had been identified, and said, what can you do with this? So I based this entire grant off of one individual. We had an individual that over a 2.5-year period, he had 438 law enforcement contacts. He had some developmental disability issues, some mental health issues. We threw everything at him we could as law enforcement to fix the problem, and it didn't work. He was calling up to 20 times a day to 911, screaming at our dispatchers. We lost dispatchers out of the frustration that nothing was being done. We tried 5150 holds. We tried every service we could find. We looked at conservatorship. We tried sending them to jail. It didn't work. So what I ultimately realized was it was not the job of a badge and a gun to go out and fix this individual. And I said, how would I fix him if I had the ability? Well, I would give somebody to him that was an advocate for him, that was his advocate to make sure that he was being attached to the resources that should be taken care of him. And with that, Crew was born. We were given a grant from Behavioral Justice Intervention Services, BHAB. It was supposed to last us 2 years for the hiring of 2 full-time social service liaisons. I greatly regret that name at this point because I've had to write it many, many times, so at some point we're going to fix it. But for us, they're Crew team members. So they came out, and the mission was fairly simple at the time. It was to reduce contacts between individuals with mental health illness or substance use disorder and law enforcement. That was it. So what is my role in that? So I've supervised this program since the beginning of it. So my role in that is we meet weekly or bi-weekly, and I ask the question, if I'm up to 4 of them now, my Crew team members, how does that meet this mission? That's the primary mission. If we've got some stuff on the side, maybe we can spend some effort somewhere else. But how does what you want to do with that client meet that mission? So the Care Response Unit started kind of wonky. We've had our failures, we've had our successes. We started out with 2 folding chairs in the back of a 2022 Pacifica van, which is what I could afford under the grant. And they drove around and they got out and they started talking to people, and it looked really cool, right? We were sitting in these folding chairs, we were out there with the public. It wasn't fixing anything. So then what we looked at was we went, okay, how do we make this look effective? And what is the metric of success for a program like this? Well, the metric of success is reducing the contacts. So what we found is we looked at and said, who is the biggest pain in the butts for our law enforcement officers? And I'll admit, when they started, our police department and our patrol officers were not huge fans of them. We brought them in, they were paid pretty well, they got cushy offices, they worked a Monday through Friday gig, and they kind of became rock stars really early. So how we sold that to them is we went to them and said, what problems are you tired of dealing with on a daily basis that you would like crew to work on? So we started getting 1 and 2 names, and we threw everything we could at them. As that went on, we kind of went to a more focused client, lots of time on them. How can we make some adjustments? How can we reduce those contacts? And we found some really big wins, where this individual that went from 438 contacts, and thank you very much for my Anchor and RCS partners that helped us solve that problem, went to 0 contacts. We haven't had contacts with him in 4 years now. We still see him. He walks by our police department. We had another individual that had lived on the streets. We had begged to get into shelter. We had offered everything. I'm going to talk about our emergency weather shelter here in just a moment. Tried everything, couldn't get him in there. We finally got them off the streets as well. And again, we were getting 5 to 10, 15 calls a week. Most of them calls of concern, not a lot of nuisance issues. We haven't had calls, I think we're at about a 2.5-year mark now. I'm going to come back a little bit more on the anecdotal stuff, but I want to start talking about some of our other programs as well. We took over the emergency weather shelter 2021, I believe it was. That program was previously ran through the hospitality center on a basis that we would use different churches around town in order to provide this shelter when the weather met certain conditions. It was a little underused in my opinion. I think we were averaging like 9 individuals a night. It was also very expensive because it was a staff-based model. It also caused some waves in the neighborhoods around it because nobody wanted a temporary homeless shelter in their backyard, reasonably so. So I believe how it went was nobody was going to pick it up, and so I think we were probably the first police department in the nation to say we will take over a homeless shelter and we will do it more effectively than it was being done before. I can tell you right now that on year 4, we've had 2,300 bed nights that we put somebody's head in a bed and got them out of the rain and the cold, and we've had about 200 unduplicated clients utilize that service. Now going into year 4, we've had several individuals that have used it the same time over, and so we are kind of looking at how do we fix this individual that's been coming to our EWS for 3 years now. This is our last year that we're funded out of that. I may get this wrong. It's funded out of HAB funds. The county has provided that. We are extremely grateful because it's been really successful on a lot of different metrics during the winter. It's lowered our calls for services during the winter, but probably most importantly to me and my team is it has given us an additional carrot or leverage point for our repeat individuals that we work with. We do have rules there. We don't throw people out in the cold. However, you can't go in there and do your drugs. So we do random room checks, and when we go in there and the first time that the alcohol is found in there, there's obvious use of drug use, they are told they got to come down and see me, and then we'll decide if there's a ban in place. We usually give them 3-4 warnings. But it allows us to get them in the door to talk to a care response unit team member outside of that. So we have some funding left this year. I know it's getting tight. We're now looking at as a bed nights. And so what we may be looking at now is shortening the season at the back end, at the front end, or potentially raising the weather conditions. Right now it's more than 40% of 0.1 inch of rain or lower than 39 degrees. We check that every day at noon, and then it's posted whether it's open or not. They have to go to the hospitality house first because that's the first line of shelter to try to get a bed there, and then they come to us. After the EWS came Project Right Now. Project Right Now was funded through the Youth Opioid Response. We applied for it, and we wanted to look at a model where we could try to get additional help into the schools, and specifically after school and during the summer. Fort Bragg Unified School District has done an amazing job of adding all kinds of programs. I love it. They're all over the place. They've got counselors for them. My own daughter has gotten a free counselor now for 12 weeks. The problem is Friday at 5 o'clock and June 15th-ish, it all turns off. So Project Right Now originally was to try to bridge that gap. We did what was called, we tried it with a success coach model, where we brought on subcontractors that went out, and their role was to basically deal with individual kids that were experiencing substance use disorders and try to be that phone call late on a Friday night. When we applied for that, and I did the interview with them, they laughed at me. They said, "You are the only police department in the state of California that's come out and applied for a youth opioid response grant." And I said, "If you give me the money, I'll do cool stuff with it." I will be honest, the first one didn't go so well. There was really great stories. We had an individual, a young youth, a 16-year-old that was placed in a Redding substance use treatment center, and he left and he was on the streets for 6 months using fentanyl. He called my Project Right Now at about 7 p.m. on a Friday, and I give a shout out to her. Bethany Brewer was on the road immediately with somebody else and picked him up in Redding and drove him to juvenile hall. because that's where he had his warrant out of, or at least a pickup order type thing. So we had big successes like that. We made movements. Unfortunately, the contractor model, I think it got too far away from the police department, which we lost some kind of control of it. We did do good stuff with it, but that funding did end. They extended it a couple times. That funding did end about a year and a half ago. We're going to come back to that because they liked us enough that they refunded us again. Right about that time in 2023, late 2023, early 2024, we had 2 tragic fentanyl deaths on the Mendocino coast that kind of rocked our community. We started getting calls at the police department saying, what are you doing about this? So we said, we'll figure it out. So we started what was called the Fentanyl Task Force. We put a call out for a wide range of people that would get at the table together and try to brainstorm. The Mendocino coast is one of the most unique places I've ever lived in my life. I've lived in 10 different countries and in several different states, and it's unique. Can't replicate it anywhere else. So we knew that we needed people that were subject matter experts in the culture. We put out that call for applications. We got 33 of them, if I recall correctly. We whittled it down to 21 individuals with lived experience, education, elected officials. And the first thing we had to figure out was, what do we know and what do we want to know? So we had our first meeting. It was about 5 hours long. We brought in some subject matter experts, and we did a lot of breakout sessions and a lot of group thinking, asking a lot of questions. And what we did with that first one was we asked this task force and said, what do you need to know to do something about the problem? So we came out of that with a list of like 100 questions. And I said, okay, now our role as the care response unit, we're going to go back. We're going to take, we said 3 months. It took longer than that. We're going to go back, give us 6 months. We're going to bring you back to the table. We're going to answer the questions. So we had a second meeting with the Fentanyl Task Force. That second meeting, we brought them together. We sent out about 20 invites to individuals that we had identified during the first meeting as being stakeholders in the fentanyl crisis. We had 8 agree to show up. We know it's intimidating often to show up in front of a task force with the organization and going, what are you doing? Are you doing it right? Nobody wants to do it. We totally understand why some people did turn us down. During that second meeting, when we brought those 8 groups in, we asked them 3 questions. We gave them 5 minutes to present. It's not a lot, but when you get a bunch of people together, I only got 5 hours. It goes by really quick. The 3 questions were, what is your role in the fentanyl crisis? What gaps are unfilled? And what would you do differently if you had unlimited funding? That really kind of gave us some ideas of where we were heading and what we wanted to do. So we ended that Fentanyl Task Force meeting by breaking into 3 subcommittees that we identified as 2 we could achieve, 1 was a pipe dream, but let's try it. So the 3 subcommittees were, the first one was access to treatment. Access to treatment was, we wanted the goal of if a youth walked in and talked to a school representative and that school representative thought that they needed substance use treatment, that youth would be attached to that treatment by a qualified professional within 1 hour. I'm excited to tell you, I think we've accomplished that today. You're going to hear a little bit more about Project Right Now coming back here in just a moment, but I think we've met that goal. The second one was what was called the Education Committee, and it was really focused on educating students, educating business leaders, and that one actually came from Tim, who I know is not here today, and he said, us as business leaders, we want to know how to recognize this in our employees and how to get them help. Tim will tell you, he called us when he had an employee that was struggling, and we got that employee in an inpatient rehab on the other side of the states and got him back for him, and it was really amazing to see him care about his people like that. The third one, the pipe dream, was to conduct a feasibility study and try to figure out why we don't have an inpatient rehabilitation facility for youth anywhere north of Tarzana that takes Medi-Cal. You talk a kid and their parent and they're going into inpatient treatment, and then I got to drive them to San Francisco and they got to wait on a flight to get down there, and then mom and dad's got to leave them in an unlocked facility. We're failing as a state. It's not fair. And we know that's a pipe dream. We know that the money's difficult to do. We know that there's a ton of complications. So that's a feasibility group that is simply asking questions, trying to gather data. So hopefully when maybe that shovel-ready project funding comes up, we can go, we've at least got a start on that. The Fentanyl Task Force, those committees still meet about once every month and a half, and it goes on. From that, and I'm trying to go a little chronological so you can see how we got here. Then we had the Return to Project Right Now. Yor reached out to us again, said another pot of funding's coming around. Are you interested? And we said, yeah, but we want to try a different model this time. One of the successes that we had the first time with Project Right Now was we were the only organization, because we did a lot of meetings with Yor and the other groups going, what's your struggles, what's the unfilled needs? And they all said the same thing. We can't get into the schools. We can't get in. They don't want us teaching this stuff in the schools. And some of the reason we found out by that was because we have found sometimes the materials that are being brought into the schools often come with ancillary materials that cause some issues. Maybe it's sex education. Maybe it's harm reduction. And so it's difficult sometimes to get into schools, and we're looking at them when we go, we have an amazing relationship with Fort Bragg Unified. So this time what we did when this funding came back around is we talked to Mendocino College, Fort Bragg High School, Noyo High School, and Mendocino High School. Mendocino's Unified School District Superintendent is actually part of one of these grants for me. He does research for him. He's brought on as a part-time admin assistant or admin analyst for me, so he already knew what the program was about. So those 4 schools came together and said, we really could use somebody whose focus is helping us to educate, helping us to make sure that we have that access to treatment within 1 hour. Somebody that is the subject matter expert for those social service liaison portions. So we hired Daniela Aguirre out of that. We've started our meetings with the schools this week. She's on week 4 with us. She will be in the schools full-time Monday through Thursday, with Fridays a documentation and a meeting day within the next 2 to 3 weeks. They're very excited to have her. And it was really cool to see what each of the schools really wanted out of that. Mendocino College said, we don't know if you're going to have the type of, we need an instant treatment for our students just based on our demographics. But the education portion of how they can look for it, how our staff, if we had somebody that was just focused with that. So she'll be working, Danielle will be working with Lisa Burtis over there, who's their clinician, and to kind of start to work with her to say what can be a force multiplier for our school. Around that same time, Prop 47 came out. Proposition 47 brought in $2.5 million over 3.5 years. That is the funds that are coming back after Proposition 47 passed. The money that we save by individuals not being incarcerated was supposed to come back into our communities. It's starting to funnel back through. So we applied for that and we received that. The county loaned us their grant writers on that because it was a short turnaround. And we agreed and said, we want to go south. We want to help out Mendocino. To be honest, a lot of our clients are already outside the city limits, but they still do come in. We're a hub community, and we understood that. We were awarded that funding. Melissa Johnson serves that role for us. She spends over half of her time, I'm probably a full-time body, on assisting individuals that are living in the county area outside. She is down there regularly on Tuesdays for the feeds, and then she's in direct communication with the sheriff's office on the coast for what we call referrals. For example, they called her the other day and said, hey, I've got a mom and a dad and like an 8-month-old baby that have been living in a car. They came out here for the Grateful Dead concert in San Francisco back in July, and they went north and the car broke down and they're stuck here. So that's been her most recent thing that she's working on actively. Prop 47 also, it required 150% pass-through of any funds that came to the local government. We found that pass-through to go to a community-based organization was Hospitality Center. 1.5 million passes through to them. That's supposed to hire a part-time mental health clinician, which my understanding is still working on that. It also hired their version of a crew team member, and it paid for 6 transitional beds, 1 emergency bed at the Hospitality House. I'm going a little over, but the transitional beds right now are my coolest stuff. So those transitional beds, basically what we do is we have gotten 67 individuals in the inpatient rehab now. We are quick. We have people on speed dial, and we have relationships built, and we know what the differences of them. By the way, if you ever try to get an arsonist into a inpatient rehab, let me tell you, it's a unique spot. So when these individuals go into inpatient rehab and we know they're coming back to us, we are contacting them 2 months prior, and we are starting the paperwork, the ROIs, the releases of information. We're getting better at it, wraparounds. We have filled 5 of those 6 beds now for about the last 4 months. What's exciting about that, we just had our first baby born in one of those beds, not made in one of those beds, but born in one of those beds because we got her off the street. But what's really most exciting about that is we have an individual in there that has had multiple arrests related to methamphetamine over her lifetime. They are getting up into the 50-ish range. We have had them in there. They were one of the first to go in there. They are now working 31 hours a week on week 3. So if they're in there, they're required to work or required to volunteer. We have some funds through Hospitality House where, you can't find a job, Hospitality House puts you to work right over here, because we don't have any funds to pay for things like shampoo and so forth. So that's how they make that money. Anyways, she's going into week 3, they are going into week 3 of 31 hours a week of work. So we are at the point now where when we hit week 4, they're not going to be in my bed anymore, because they're going to go over to the Hospitality Center's funded transitional bed. Don't get me into the details of it. I don't have my crew team here because they are in peer support training somewhere around here. That they will be funded under a different program with long-term living in effect. So somebody's came out, they've got it. I've got 2 more that are coming out of rehab that are going into additional beds. And that was super exciting for us to kind of complete a cycle. It's also a little scary for us because once they come out of our bed, they're not our clients anymore. We're there for them, but I can't force them to do anything. So we've learned some stuff on that. We have a local advisory committee under Prop 47. It'll be meeting again on September 17th at 5:30 at Town Hall. That is a public meeting. And we'll be providing an update on there. We're also trying to adopt some bylaws. Yeah, and I think my last portion wrapping up for you. So where are we heading? I gave you that big long mission statement to reduce contacts between individuals with mental health illness, substance use disorder, and law enforcement. In the last couple of months, we've shortened that, and really because we've stepped well outside of the normal role of what we would look at. And now what our new kind of core mission statement is treating the chronic to prevent the acute. And what the goal is what we're finding now is it's an acute problem for law enforcement to go out and put handcuffs on an individual that has a substance use disorder and a mental health issue and shove them into the jail or into the hospital and weigh that system down. And we're trying to solve the chronic problem underneath it and looking at that. Metrics for success, one of my last portions. Again, I can run you through some stats if anybody wants, but what I really want to look at is we look at the number of days that we don't have contacts with individuals, very anecdotal evidence, because it may be a mental health, maybe a substance use. The barrier that we have been having recently is we want to see the reduction in costs on the Medi-Cal system related to them not going into the hospitals over and over, not using several of the services out there. That's a hard one to get because of HIPAA. We're trying to convince the hospitals, what if I give you like 30 names and you just give me an average? Can we do that? But that conversation's probably down the road. The last two pieces for the next things we've got coming up, sorry, I'll give you the last one. We should have a website up in the next 2 weeks. I'm waiting on final approval from City Manager Isaac Whippy for some overtime budget because I don't have it. That website will have a one-click button on it for the Mendocino Coast where if you're experiencing a substance use disorder or a family member is experiencing a substance use disorder, you click that, you can be anonymous, you at least got to give me an email or a phone number, and a crew team member will be in contact with you within 12 hours to try to connect you to some type of services. We're not going to come out and see you on a Saturday at noon. I'm not there yet. I hope not to get there. I hope somebody else gets there. But we will get on the phone with you and we'll tell you, here's your options, and we can go down that basic triage. And with that, I went way over, but you got 5 minutes for questions.
3.5. Yes.
Thank you. Captain?
Thomas.
Thomas, thank you, Thomas. Really inspiring work you've done. I was really impressed with the whole crew team model. It's one of those things that seems so simple and it sounds so effective. I would want to know, are there other cities around the country that you found some inspiration from? But in that mind, for other cities that are looking at you and the inspiration from what you have done, what was probably the biggest hurdle in getting that crew team up and running and off the ground? And what do you see as the biggest hurdle keeping it up and afloat?
First part of the question, we didn't grab inspiration from anybody else, but we have replicated this program and assisted other ones for getting grants in several different communities. San Mateo is our most recent. We sat with them, we built them. We'll send our crew team members out to come ride with your agency. Tell us what we do. So getting replicated other places, the Fort Bragg model is on several different levels. Probably the biggest hurdle was convincing individuals that was getting out of the box is what we called it. There was a lot of when we started, you can't do that. And we heard it from all over the place. You can't do that. Why not? You can't do that. And so we worked really hard to get outside the box. We took some hits for it. We did make some enemies. We're trying to amend those relationships now because we know we need them on our team to be effective. But probably that. Just convincing people that sometimes the current model, we may need to look outside of that. Yes?
How does Fort Bragg PD interact with crisis? And so this is beyond housed individuals, with crisis in mental health and in the hospitals.
When you say crisis, are you talking about our teams or like RCS Tapestry type stuff?
Yeah, I'm talking about the service providers, so like RCS and Tapestry, not crew specifically.
I think it's reduced quite a bit. I have a really good relationship with Denise Addison over at RCS where we work through some really complex problems. We've done a lot less of the old school of I'm going to fight you out in the street and I'm going to drag you to the hospital and take you in there, medicate you, and then handcuff you down to a bed and hope you're okay. And we've done a lot more of making sure that we've exhausted what we can do on the crew side before we call RCS. RCS has been really neat about coming out in the field with us sometimes, which has reduced stuff. My officers do not interact with crisis really anymore on outside the hospital, but if there's a 5150 hold that does require us, there is still that communication on the initial handoff. However, crew then steps in to go, can we be part of the exit plan? Because we know we may get this person stabilized and they're going to be back out, and we want to make sure we catch them before they go. Did I answer your question?
Yes.
Captain, I want to talk just a little bit about conservatorships. There's a stigma that goes with it about, I don't really want to do that, but around taking away people's rights. You guys have had some good examples of how it helps. You've got one person in particular in your community, I think you touched on her a little bit, but she was, I think, sleeping on our streets for a little over 2 years. And lots of complaints in the community, helping you allow this to happen. I want to hear about, once you got the conservatorship, the turnaround that happened.
Oh, it was immediate, and they're difficult to get into. We have 2 individuals right now we're actively working on that are right on the verge of conservatorship, but that one individual we're talking about, it was an immediate change, and it really was what needed to happen. And I have this conversation with my team a lot because they get emotionally connected to their clients, as obviously so, and so we have this talk a lot. Can they take care of themselves or can they not? If they can take care of themselves, then they're committing a crime. If they can't take care of themselves, then we need a conservatorship. And those are kind of the 2 branches, and they intimately know these individuals, so we do talk about that a lot. Hope that answered your question, Supervisor.
Do you have information brochures or something you could leave us?
I hate brochures. I do have, if all of you want to scribble down right now, crew@fortbragg.com. You email that goes to my entire team. We're quick about getting back. You want to know if we can help with something? We're well outside of the realm now. We help with restraining orders, and really they help with our law enforcement officers. I mean, if we go out now and we have a code 3 call and we're doing CPR on an individual and that wife's there, and the fire and us and the ambulance are working on them, crew comes out with us and they get with the wife. In our emergency management plan, my crew team, that is our plan, that if we have a major disaster, they work for underrepresented communities such as our unhoused, mental health, substance use disorder. That is their job. You make sure that they have what they need to take care of them, and they let us know. So they're a force multiplier. We do have a brochure. If you shoot me an email, I'll email it to you, but I did not bring any of them with me.
Do you have a for the website opening?
I am waiting on the approval of the city manager of the overtime, because one of my favorite parts is that big button at the top. We've had it in our head. Right now, individuals email us, and it's just not as effective. But if I had to guesstimate, we just had to send the page off to Youth Opioid Response for Project Right Now because they have to approve it. So that went off this week. So if I had to guess, 3 weeks.
Do you have a business card that, I know you don't like brochures, but
I think I've got one.
a
If not,
business card would be helpful so we can get it into the record as well.
I will. I think I'll have to run out to the car and get one. I was running late this morning. I got stickers. I'll get you one.
Thank you.
Thank you.
Thank you.
We really appreciate it. That drive over 20.
Yes.
Okay. The next presentation we have is Ukiah PD. And could you tell us who you are, please, other than Ukiah PD?
Yes, ma'am. Good morning. Good morning, everybody. My name is Captain Jason Chapman, Police Department. I was asked to come today to speak on 2 topics. The first topic I will cover is the mobile crisis unit that UP utilizes in the program. I'll start with the Heads Up program first that UP utilizes. I want to give shout outs and thank Van Zandt. You all know her. In my book, she has been a rock star and assisted UP with assistance for individuals that can services. Not only is she helping us with that, but there's along the lines of dealing with transient enforcement and the large scale encampments that the city has encountered in the past. I know in the past I worked on a special enforcement team which addressed homelessness, and at that time we really didn't have that tool to utilize. And I think people that live in Ukiah, I think have all dealt with those and seen them. I can give an example of the airport runway area on Talmadge and Bruce Lane. Airport Road was a big issue that Ukiah was dealing with at that time. And I believe if we had that program during that time, we wouldn't see those. So as a result of Megan and her crew and working in the county, you're out whether she sees an encampment or an area behind Costco or behind a softball field, we're getting automatic notification of those events because there's that great working relationship, right? We can utilize the resources, maintenance crew, UPD assistants, street warrior, encampments up, get the resources out to the individuals that are how substance abuse issues as well. I can't say it enough, Megan has been a great partner for the community. We try to immediately bridge back it out. Her and I talk weekly, it's out monthly at this point, develop ideas and things like that, strategies to address the issues that are popping in Kayak. So I just want to give a big shout out to Megan. The second topic I was asked to speak on today is the mobile crisis for the county. It has been a great resource in the sense of law enforcement is no longer going to those types of mental health calls where the mobile crisis crew is responding first. And it's not the badge again, it's the mobile crisis unit that's there, and it's been a huge success. And the ultimate goal, I think law enforcement is looking for at that point is that we're not going to go into those calls. They come into our dispatch center, that is automatically being dispatched out to that 900 unit, as we call it, and they are responding first. They have built that bridge between law enforcement, community, and that work, which has been a huge success because now, whether it's a 5150 call, for example, Megan's crew can show up, and when we first started this, we were going with them. Now, with repeat offenders, I say that, they are just going by themselves now. And if they need law enforcement assistance, they will call us. They have bridged that gap where now they can handle those calls for service on their own. RCS is now taking over that program. We've had a lot of sit-down meetings with them recently about how that's going to look because of the relationship with Dan. I know Katie Small was there before Dan. I don't know if you guys know her, but a huge resource. And now RCS is involved in this program. And they've taken our advice. They built that bridge with us as well. They're rolling out their new program. You guys seen success so far with that as well. Really haven't had any issues come up because I think they've seen the blueprint that Katie, Dan, and Becker built, and they're following that. So I have to give a shout out to the RCS as well for the work that they're doing and listening to the law enforcement partners. Again, what I was asked to speak on today, I don't have a 25-minute presentation. Pretty straight to the point, fast. Probably no one asked questions today, so I thank you guys for that. If you have any questions, I have an answer for you guys. Yes, ma'am.
Hi, I'm Denise Corney. I'm just wondering if you have any interest in the Blue Envelope program that the Coast has implemented, the police department? Blue Envelope.
What is that exactly?
Well, it's information that's presented to folks out in the community, and it's like an ID information. It has, especially for repeat offenders and things like that, that you go out and see. It has information for them to, on services and things like that. But it's like an ID card that says if they have a developmental disability, or they have seizures, or they're autistic and they can't respond to verbal commands and things like that. Where's Thomas? Did he leave? Anyway, Tim Bozma, who's on our board, who's not here today.
Medical.
That's okay. He's with Rotary, and they implemented the Blue Envelope program on the coast through the police department. And I'm really curious about getting that implemented here in Ukiah.
Yeah, if you have some information on it or that, or it's a pamphlet. I like pamphlets. I like Thompson already, so
In the past, the Ukiah Sheriff Department funded a program where I work with the State Council on Developmental Disabilities, and we would make ID cards for our folks that had developmental disabilities. And anybody, any parent could apply for it. And that way, if they're stopped on the street, they're acting out, it says exactly, who to contact, what their disabilities are, if they have behavioral health issues, if they need medications and things like that. And the machine broke. And they're very costly. But anyway, that was provided by our Sheriff's Department. Of course, now it's dead. But then when I heard about the Blue Envelope program that was being implemented, I thought that would be a great idea for Ukiah to do.
Yeah, if you have that information, let me get that from you. Just a little backstory. I work for both agencies. I work for the Sheriff's Office and Ukiah PD. So I work all throughout the county pretty much dealing with issues, right? What I can say about both agencies is that the individuals that are working the street are very well versed in all the programs that the county has to offer, referencing to the individuals that are asking for help. But if you have that information, I'd love to get it from you, or put me in contact so I can do some research on
They
it.
have a website. It's a communication so that you have it as up, and there are badges and things so that when there is a crisis situation, it can be a fast way to recognize that they have certain needs, certain triggers, how to respond to them. And I think it's law enforcement started, you know.
Yeah, we have our own, like, this is called our CAT system for dispatch that notes are put in how individuals when we come in contact with that dispatch can advise on an officer to go on scene for them to say, hey, we're out so-and-so, that information is passed on. But I'd like to look into this program that you're describing. It'd be great.
If you've got a card, I'd be
For a
glad to do
business
that.
card also, so we have a way to contact you.
Yes, ma'am. Good, of course.
It's been very effective. And our ID cards, I'm sure clients still have them, but, we have new clients that enter the system every day, and I'm sure you run into folks every day that could use something like that. It prevents a lot of issues from escalating by having that information that they can take out of their wallet and give to you.
Yeah, no, again, I'm a huge proponent of this mobile crisis and the heads-up program that's created with less law enforcement contact. The whole goal to de-escalate situations that officers are now crisis trained, right? Sending someone in non-uniform capacity with a badge and a gun, right? It's a calming effect on the relationship that's built. I know as being a SWAT member for a very long time, once we started having local crisis, it was such a huge tool to have when you're responding to an incident in the county or the city where you could have that resource with you right away, waiting for the crisis team to come in. You already have that established local response. So I can't speak for it enough. It's de-escalated a lot of situations where they have to turn violent and use of forces haven't occurred because we're able to send a local crisis person or maintenance crew. So UP has been very thankful for these programs.
Thank you.
So I live in Ukiah, and I've seen visibly the difference that the work that UPD and Heads Up have been able to do, especially when there's specific individuals. Can you talk a little bit about UPD's training experience that officers have for crisis? So it's great that the county crisis team and now RCS's crisis team are going out, but what kind of training do the officers get on a regular basis that helps them deal with people with mental health issues?
Yeah, a lot of us went through that crisis intervention training that was about 4 or 5 years ago. And it's kind of built off that, and then obviously it's established in the FMTO curriculum through the state. And then again, meeting with Megan, and then meeting with the mobile crisis crew like Dan and Katie. I can't say enough about it. She's still with us. But again, it's just the conversations and the trainings that are brought up through the training program is how they're doing the training. And then whatever extra trainings that come up throughout the year, we'll try to send them to.
Is your people out there, are they bilingual? Do you have non-English speaking?
Yes. Yeah, we have a couple bilingual officers now, and then ultimately we have some staff too that utilize.
Any other questions?
One question, probably not asked too much, is what's missing?
What's missing?
Yeah, what could be better out there that's not being offered by? What do you see out there?
Good question. think more resources on the mobile crisis and more personnel would be huge. I think we talked about 24-hour coverage a little bit. Is that a good way? It is. So I think that's the biggest thing law enforcement is asking for. And now that that's implemented, I want to see where that goes, because there's kind of that, let's say, 9 to 5 period, and during nighttime, who's president, right, to some degree. Now that we have that and start implementing that, I'm looking forward to see where that goes, having that 24-hour presence now, and have that response instead of, like I mentioned, an officer showing up. Now you have a mobile crisis personnel. So I'm curious to see how that plays out.
How about youth? What do you do with the kids?
The youth programs.
The youth that you run into out there?
Yeah, so
Where do you take them?
I'm really glad you asked that question. We have a new school resource officer. He started halfway through the year. His name's Michael Jensen. And he's been on his first year of the high school and throughout the elementary schools, in the junior highs, out in Nollyville. We started working with Nollyville recently. But he's a huge resource to get into the programs, that mentorship. I know Tapestry is, I think, one of those resources that he's talked to a lot lately. In contact with juvenile probation, to counsel the individuals that may need a little bit more assistance with the predicament they may be in. He's done a really good job bridging that gap, reaching out to the community. He's been very active in the community. I think he just did a bike ride at Grace Hudson, reaching out, providing just like the helping hand, right? Building that courage between law enforcement and establishment as well.
He's on your staff?
Yes, sir.
So he's an officer?
Yes, he's a school resource officer. Correct.
School resource. Okay, thank you.
Again, I just want to thank you guys for letting me speak today. Just 2 business cards.
Yeah.
Okay.
We'll make sure everybody gets what they need.
Thank you.
Thank you.
Thank you very much. Great. Okay. Moving on, we are going to be getting our substance use disorder providers reports. Okay, our great timekeeper here is 7.5 minutes each. She probably has one.
I'm Jackie Williams from 4th Street. I have the update I want to share with you today is where we are in relationship to opening our expansion efforts at the Ukiah Recovery Center. That's our largest program. That's our SUP focus. But before I hop to all the good news there, the other important thing we deliver to the community is food bank. And so you're going to see some things from us this fall that look different than in the past. I think our need to raise more money because we've lost the federal food programs and we're serving more people has really created a need for us to really pay attention to the underserved. So watch for being hit up more frequently in the future. And now the good news. We are literally days away from final inspection on the construction site. So let me remind you what that is. That's a large, what we're calling a treatment pavilion. It's got a couple group rooms, one-on-one office spaces for counselor and client meetings. Today, we only have one group room in our facility. So this gives us the opportunity to provide smaller groups and more, literally deliver more program options. So the team's very excited about that. For those of you that know Ron Arkin, Ron was the original PD of 4th Street, so we named the big room the Arkin room. And we're going to have our very first all-staff, because we finally have a room big enough for all of our staff. And Ron's going to come and deliver a workshop. So we will have Mr. Arkin presenting in the Arkin room. So again, final inspection's Friday. So we kind of backed away and created a plan from that time on what we expect. The increase the sober living environment funding that has been provided by Northern Circle to help us build 24-bed sober living environment. That happened in time for the project to be all completed at one time. And so I expect, because we don't want to delay people that need housing until after our ribbon cutting, we will have our staging ceremonies. We've already started the selection project for people. We'll have some people already moved in before we have the ribbon cutting. So if, knocking on all sorts of wood, if my plans come true, we will have the ribbon cutting on 9/12. That's a Friday morning. We ask people to come and park at the River Church because we probably don't have enough parking for everybody. Janine will be there to provide everybody with an update of the other things that are happening in our community. And then we will literally acknowledge the folks that have so helped and cut the ribbon. And then it's just an open house, so people will be invited to wander through both the sober living dorms and the new facility. I also wanted to acknowledge that the county contributed $57,000 of the settlement money to help us buy all the furniture for the sober living environment. So again, lots of people have contributed to bring us where we are today, and we are just so excited to get across the line. I'm at that stage where the things that aren't quite done right start popping up. Like yesterday, I got a call that said, Jackie, the landscaper is just, really working hard and it looks really good. Better come over. Why? Well, some of the plants are on the other side of the fence. So it's the detail. So we didn't have, one soap dispenser short. That's the level of detail we're going down, and we had to move. So I do think we will be ready for a final inspection on Friday, and I'm just hoping it continues to go well.
Congratulations.
Thank
Wonderful,
you.
wonderful.
Oh, what that means is, and rather than serving 40 people on that site for withdrawal management and residential treatment and no sober living, those numbers really increase. We will have the additional 24 folks in sober living. And then that created space to add more beds in residential treatment. So, we're approaching 60 people living and going through the recovery services in all aspects.
Good job. Thank you.
Oh, let me turn this on. Jolene Treadway, Redwood Community Services, and I'm here to talk about our substance use disorder programs. These programs are near and dear to my heart, and started because a Dr. Kimberly Fordham, who works for the Adventist Healthcare System, came to us in 2013 and said, I'm tired of delivering babies tox positive with moms, and my only option is separation. What can we do? And so we started a journey that took 5 years until we opened the doors of Thule House, which is located in Upper Lake, California, but does serve Mendocino County residents as well. So we are perinatal residential. That means we serve pregnant and parenting women. We also serve women who are not parenting over the age of 18, but our primary focus is always those pregnant and parenting women. And they can bring their children with them up to the age of 12. And we support school enrollment while they are in program so that they can learn to engage in recovery and begin to live a recovered life with their children present. Because one of the biggest stressors for anyone who's a parent is your children, right? And so getting to learn alongside them and have that support of professionals every day while you're also figuring out your recovery journey has been really great. And so referrals are on our website, and again, we accept any Mendocino County woman who's over the age of 18 who has Medi-Cal, but also pregnant and parenting specifically. And we are a BHAB recipient, and so we are hoping to break ground late this year, and our beds will expand. Currently, we have 8 treatment beds and 7 children beds, and we are expanding to 16 treatment beds and 14 children beds. So we're going to double the amount of people we can serve and children we can house at one time. And then on
Upper Lake, or
yeah.
it's all it up?
Mhm. Our residential services are in Upper Lake, but we are contracted through partnership to serve Mendocino County, as well as we have a SABG contract with Mendocino County for women who don't fall within the partnership services. And so, and then we work with New Life, so if women have a need for medication-assisted treatment, we bring them over to New Life Clinic for those services. Yeah. And then we also have a license and certification for outpatient services. Currently, we don't operate any outpatient services through Drug Medi-Cal. We do operate prevention and early intervention services through our Restorative Justice Youth Council at the Arbor in partnership with Mendocino County Juvenile Probation. And so part of that program is any youth that has an identified substance use history or is at risk, maybe they have family members who have SUD that is known, we provide education and early intervention to both the youth as well as their families. And so we engage the families in that process. And we are actively working to expand our SUD services. So we have 2 SUD interns coming on in September. And they are going to work under a licensed SUD counselor we have in-house to provide community-based services in our residential programs. So they will go to our crisis respite, crisis residential, as well as building bridges, and provide services in the community to adults who need SUD treatment, rather than them having to come to the office. We do have a certified office. It's on Gibson here in Ukiah. We're in Red Valley. And so that's what we're looking forward to working on over the next several months as we onboard those staff in September. Yeah. I don't know if anyone has any questions.
Yeah, I think it's great that you're going to be offering SUD services on site. I had a question about, so how long is the waiting list?
We currently don't have a waiting list. We actually have openings. Yeah. And if you have a client, you can call us. We'll walk them through the process to get approved they have to call Carillon, but we do a 3-way call, support them through that process. We'll come get them, or we'll have someone from, like, if they're known to an RCS program, because we have a lot of RCS programs, we'll get them to treatment, we'll get them to our door. Partnership will also drive them. And if they graduate, partnership will drive them back. If they leave against clinical advice, partnership will not provide them with a ride. But yeah, so we'll get them there. Any other questions? No? Okay, thank you.
Thank you. Okay.
Good morning.
Good morning.
My name is Olivia Bixby. I'm a family and addiction medicine physician. I'm the medical director for Life Clinic. I have been in Ukiah for 1 year serving, and I am excited to share our updates with you. So far, we currently have 315 patients enrolled in our clinic, and that's a combination of people receiving methadone or treatment for alcohol use disorder, methamphetamine use disorder. We have currently treated or completed treatment for 46 patients with hepatitis C, and 40 of them have confirmed cure rates. The remaining 6 has been long enough to confirm yet, but as we get the confirmation, we'll be able to report that to public health as well. We are actively hiring as we're expanding the census growing, so we have just hired an RN to come and work with us to help really help work with the providers and the back office staff, our medical assistants, providers. We've hired another substance use counselor who's coming down from Eureka. Her husband is actually working in Lake County, so it's perfect to get a little bit closer together. I am actively hiring for 2 more positions to provide basic primary care services and addiction treatment services as well. Things that are coming down the pipeline, SAMHSA, or the federal guidelines for methadone, they changed as of last year. And then DHCS finally published its recommendations for methadone treatment changes, and those go into effect September 2nd. So with those changes, we expect to see different things. So for instance, changes in how we are testing patients. We're able to do salivary testing for patients who cannot provide urine specimens. Sometimes you can't provide urine specimens that veterinary is automatically marked as unfavorable or we're not doing it well. But now that we can legally use saliva, that will change things for us, especially for our patients who may not necessarily produce urine, so like our dialysis patients. Other things that are changing with the new laws are how frequently we're monitoring our pregnancy patients and who can actually monitor. Another change that we're having is physicians that have patients with substance use disorders, they're able to do their full physical exam, send it over to us, and as long as we review it and certify it, they can get administrative treatment a little quicker. We have expanded our hours, which is a change as of August 11th. We are now providing services from 6 in the morning until 3:30. We are asking patients to get there between 2:30 and 3 o'clock. The intake process is review. It takes about an hour, hour and a half. We ask a lot of questions, get a lot of blood work, do a full physical. If you are medicated with methadone, we're asking patients to get there between 3 and 3:30. That way there's no delays. If you have to do counseling, we will ask them to wait to complete their counseling, or you can keep their therapy services before receiving medication. And so the ultimate goal is to expand our hours completely as we continue to grow. And so hopefully we'll end up going to a 6 to 5 model eventually, but right now it's 6 to 30. Currently on our staff, we have our clinic director, who's Jill Teagard, she's a PsyD. And then we have our assistant medical director, Rachel Chavez, who's a physician assistant. And then I do have 2 nurse practitioners on our staff right now. And we just interviewed one other physician down from Oakland, who completed family and addiction medicine, but also does behavioral health work as well. Any questions?
Can you talk a little bit about, I think maybe you do have a little bit of group treatment or and other services that you offer to folks just besides the medication?
Oh, yes, absolutely. So we do have groups that are led by counselors or our licensed therapists. So some of those groups will be something like our group for journalists, others are dialectical behavioral groups, how to process your emotions, and relapse prevention groups as well. Those are led by our therapists. If a patient does have a co-occurring mental health diagnosis, bipolar disorder, anxiety, depression, even schizophrenia, they are able to receive medication through us as well. Those are long-acting injectables, Abilify and Vega. If patients are, I'm used to being in every new account, so they're tier 3, so somebody requiring Clozaril, do not manage that, so we will refer that out to Anchor and help co-manage. So we'll monitor if they're coming in to see us every day. If we're noticing that their symptoms are worsening, we'll let them know, try to get them in and go over their appointment. I do have 2 licensed therapists. I have 1 male, and then I have 1 female, and then we're actually hiring for 1 more therapist as well. Thank you so much.
Thank you.
Thank you.
Good morning. So my name is Jill Ells, and I am the manager of the county outpatient program. Before I give you an overview of our program, because of my pending retirement, which will be in 4 months, Angie Lewis, I want to introduce her, even though I'm going to give you the overview today, has been identified as acting manager of the county outpatient program. So I didn't want to throw her under the bus this morning, but she will probably be presenting the next time we have to present. So with the county outpatient program, we have 3 sites. We have Fort Bragg, Willits, and Ukiah. Our groups, we went to a client-centered program. So our first group starts 9:30 in the morning. We have working groups now that go up to 6:30 at night. We also have morning testing as well as afternoon testing so that we could, for our working people, still be able to offer services and they could complete whatever obligations, whether it be probation or whatever, they can hold on to their job and still complete the obligations that they're required to complete. Within our program, we have many fingers of different sites that we work with. We have 3 programs in the courts. We have Family Dependency Drug Court, which works with our parents with children that either have a voluntary case open with CWS or their kids have actively been detained by CWS. So we work to work the families back to reunification with their children. And then we have Adult Drug Court. That is mainly focused on people with high criminal history, a lot of criminal activity, looking at felonies, possibly looking at prison sentences, and it's an alternative for them to not only get treatment, it's a very high rigorous program, but it also moves them on in their life to get them out of the criminal justice system and ideally keep them out of the criminal justice system moving forward. They can have some of their charges expunged, they can have misdemeanors totally go away. So amazing program. It's out of a lot of success throughout its years in Mendocino County. It is a spinoff from Prop 36, which was a part of Mendocino County many, many years ago. And that's how drug court evolved. And then, of course, we have behavioral health court. And behavioral health court has a lot of layers to it in all the different agencies that are involved with the clients in behavioral health court. So case managers are there, substance use counselors are there, housing managers are there, Anchor Med Management is there. All the teams come together trying to work with our clients that are identified with mental health SUD issues. We also have a program inside the Mendocino County Jail. I have 2 staff that go into the Mendocino County Jail every week. We serve the male population and the female population. I think since that program started, we've done close to 5,000 or 6,000 services to individuals within the Mendocino County Jail. We also have a counselor in juvenile hall. So we work with the adolescents in juvenile hall. Currently, the counselor assigned to juvenile hall also is assigned to juvenile probation so that they can work from the inside out with our adolescents that go into juvenile hall and ultimately end on probation coming out of juvenile hall. So it's kind of cementing that seam of services from the inside out. In the Ukiah office, we have, I think, 17 groups currently running weekly at the Ukiah office. It's a lot of groups, dedicated counselors. Some of the counselors run 2 to 3 groups a day. Yeah. So that's kind of an overview. I do want to say I'm very grateful for the captain from Fort Bragg bringing up the adolescent conversation. Janine will tell you, dear to my heart, our kids here need a program here in Mendocino County. This year, one of my biggest fears was sending youth to Tarzana in LA and our youth ending up on the streets of LA on their own. That happened this year. That happened. There was 2 youth, one from Mendocino County, both walked away from Tarzana. Of course, a bolo went out on them. We had multiple resources reaching out to find these kids. They did come home safely, but we need a program. We need a program in Northern California. So I'm sorry I get emotional about this part, but my heart is our kids. If we don't get the kids, we will never break the chain of addiction. So I'm going to end it with that. Mo?
Is there currently a waiting list for offer outpatient services for adults, and do you have youth programming for outpatient?
We have no waiting list.
Yes, we do have youth programming.
Any other question? Right now, currently, my adolescent counselors are serving almost 30 kids. Right now. Yeah.
And they're in the schools.
They're in the schools, they're in Pumalita, they're in Eagle Peak, they're in Willits, and they're in Ukiah High. Currently, I have 2 counselors that are not only serving those 3 schools, but they're in juvenile hall, they have an evening group, and then they go in during the day for individual sessions with these youth. Thank you.
Just to add one thing that Jill didn't add, one of the things that when we went to the client-centered approach was bringing also some different focus on tribal groups, bringing specific tribal groups so that we can serve our tribal members, though it's open to anybody. But Paul was a really good program, and then making sure we had Spanish-speaking groups that are cultural bilingual groups, so that we're also serving the Latino population.
Any other questions for our presenters? All right. So now we'll go on to Dr. Miller and her county report.
I got 5 minutes. I can talk. I can talk fast. No guarantee you understand. So the director report is there. If you have any questions, please let me know. We can answer any of those questions you might have. I did want to, a little off what's on here. There's a lot going on at the federal level. We are working, the county CEO, Director Ansel, is working on putting a health summit in front of the board on September 10th and bringing a lot of the health community partners to talk about what are the federal impacts on health services throughout Mendocino County at all levels. And so that will be planned for September 10th. So if people are interested, maybe in the morning, it will have the hospital, the clinic, partnership plan will be there, social services, health services, and we're working to try to get the 2 big tribal clinics at the table to talk about what are the impacts potentially from the federal cuts that we're in and state cuts that we are seeing and what can we expect within Mendocino County. So that's there's a lot going on. I think there's a lot of unknown and a lot of speculation about what this means without fully anyone really being able to state exactly how everything will roll out, what that looks like long term. The PUP, we are having a presentation from facilities today at the Measure B meeting on the construction of the PUP. And so I will have more information. They are putting out a tentative timeline this afternoon, so we'll have a better understanding of what does the opening date look like and what are next steps. I know they have some proposals to open it early, but with modifications. I'm going to hear what those are. They do need to talk to the state because they may not Medi-Cal may not certify that site with the modifications, right? Medi-Cal has to come out and certify the site, so does Medicare. So we are going to need to look at it. If we're able to do those modifications, will it be something that Medicare or Medi-Cal would certify? So that's kind of the next step, what we hear on that. At the last Measure B meeting, I know we talked about it at the last meeting, there was to move forward on a request for a proposal for substance use services in Mendocino County. That will be going in front of the board for approval to release an RFP. It'll be on consent for, I think, the 9th, September 9th, so that we can put out an RFP for substance use services in Mendocino County. One of the priorities was, as this board wanted also, was youth residential treatment in Mendocino County, and obviously a focus of not having a facility in the Ukiah area. So that is all what will go forward to hopefully have the board approve us to move forward with releasing an RFP. So we can look at potential treatment options. I know Jill and I have been pushing every partner we know to bring youth residential for Mendocino County, and we always hear it's not a cost-effective model, so I'm hoping someone will decide it is a cost-effective model and work with the regional model of partnership, or be able to work with the regions of, our regional partners of Sonoma, Humboldt, and Miller Lake, to realize that we probably do have enough kids that could utilize this facility to really all partner together. So fingers crossed that our RFP gets approved, and fingers crossed we're able to really prove to people that our residential treatment for youth is needed in Northern California. And lastly, I wanted to give a quick shout out. We did attend the Crisis Intervention. It's a national convention on crisis intervention. A lot of people come from Canada, Europe, to bring all the different models that they're doing to address homelessness in their communities, substance use, and mental health. There's a large focus, a lot more focus than last year and this year, on how to better provide veteran services that are in crisis, and how to do a better veteran approach, and make sure that we're not creating PTSD when we respond to veterans who probably have wartime experience. It's a 3-day intense training where you're like in sessions every hour and a half, you're changing sessions, and you get other like 10 sessions. I feel like 10 sessions every hour and a half, but really you get to look at what that looks like. And you get a lot of different insight into a lot of different models that are happening across the United States, Canada, and Europe. It was the first time that we had law enforcement attend with us, so that was really nice. The sheriff's office was able to send Aaron Clark and 2 correctional officers, and so Andrew and Dylan also attended. They enjoyed the training. The 2 correctional officers also got CIT coordinator training, which Karen and I got for our county too. And they're actually interested in, as I would like to, we've been trying to build a trainer model for CIT in Mendocino County. We've always needed a law enforcement partner that was willing to be the other trainer. And hopefully we're going to be able to find a law enforcement agency that has someone who's willing to get trained and do the CIT locally, so we can do the 40-hour model. We don't have a 40-hour evidence-based model in Mendocino County. And so to see what is the natural evidence-based practice would be the 40-hour CIT training that most law enforcement across the United States actually has embedded within their county systems for their law enforcement. So I am hopeful that we will then be able to move towards finding a partner to be able to really get everyone trained, bring the trainer model to Mendocino County. It'll be easier to get our law enforcement trained as needed, and not have to say, I got trained 4 or 5 years ago. They could be trained more often, so we wouldn't have to pay to bring trainers in. And there are some law enforcement agencies that have a 40-hour model and then have a 20-hour model so that everyone's trained in it, but certain officers think it's a 40-hour model, so there's actually a little bit more perks, which actually brings more desire to want to do law enforcement differently. And they actually don't just automatically do it, they have to apply and get selected to be that CIT officer for the agency. So we plan to do a debriefing. We haven't got to do the debriefing yet. We plan to all come together and sit down and say, what did we learn, what could we do different in Mendocino County, and how to model that. Any
We have
Good try.
Well, good job.
She'll push you out. Any questions for Dr. Miller?
I have a question. Where can people view this meeting and the Measure B meeting?
The Measure B meeting, it has a YouTube website, and we're developing a YouTube website for this group. But I don't look at the Measure B county page. It doesn't write on YouTube. The link is on the Measure B page, so we will add the link for this on the behavioral health advisory report page.
Thank you, Dr. Miller. Hold on, I close my agenda. We need to approve the agenda from July 23rd. The minutes, I'm sorry. Thank you. I misspoke. So I'm wondering, has everybody had a chance to look at them? Have there been any notice of changes or errors? And then if there are none, would anybody like to make a motion to accept them?
I second.
All righty. So all in favor? And Martin wasn't there, so he's abstaining. Jeff is abstaining.
I'm abstaining, I wasn't there.
Oh, okay, so that's a rousing for votes? Okay. All right. Will that pass it with, because it's the four of us were at the meeting? Does it matter?
You don't have to be at the meeting as long as
You
you
don't have to be at the meeting to approve the minutes.
Oh, I will.
There were no known errors, so I'll put mine to a yes.
Yes.
Okay.
You can change mine to from listed.
All right. Thank you. Okay, so Martin's abstaining. All right. Okey-doke. Are there any committee reports or board committee? No reports. There's nothing here either. So are there any member comments? This is going to be a record meeting.
Well, I want to say something real quick. I was really very impressed with the public comments and all of our the providers working together and growing, doing some amazing things. The officers that came to us today and all the things that they are working on and growing and improving, and the county has done a great job. We've got great leadership. Everything seems to be on the right trajectory, except for the one thing, which is that youth residential. I'm glad you were so moved when speaking to us, because I wish we were all more moved by these kind of things. But it seems pretty clear we're on the right path, but that is a big glaring red button that we need to be looking at more. So, thank you.
You know what comes to mind for me with the youth is if any of the Measure B funds can be used for youth. Of course, we're working on our hospital, which has got to be finished. But we must have something that we could start working on for youth. That's important. Anyway, but thank you for that.
The other part with youth is to look at what's available in the areas that are doing outpatient working with kids. Because my program goes into juvenile hall weekly, and I sit with the kids and talk to them about what they can do when they get out and invite them to my program, because we do outpatient with youth. And I'm not closed to just Native Americans. It's open. It's open. And I work with those kids and tell those kids to come, and they can go to our meetings, they can come and do one-on-one sessions, they can come and work with, but they got to bring their parents with them, because it has to be paperwork done with parents knowing what their kids are going through. And I do have a meeting next week with the Indian Health Service program over there in Davis, and I don't really agree with how they make people eligible there, and I think that there needs to be a big turnaround about how they take clients, because they got a brand new facility and nobody's eligible to get into the program. And it's just wrong. Who they want to see. You got this big place and there's 2 people there, and it should be full, because there's a lot of issues out there when it comes to, so I'm going to go stir it up next week over there. Cool, Martin. I hope they hear me, because I'm not coming there to put them down. I'm coming there to say, what do you have to change in your eligibility criteria to keep these beds full?
And when Janine says, putting one here, people say it's not financially reasonable, they might be looking at the Davis model, and yes, if you only have two, if you don't let anyone in there, it isn't reasonable. Yeah.
Used to have it, it's like if you have eligibility for this new unit, it's going to be opening up. It used to be the pub unit. You got eligibility, no one fits the criteria, you're going to have nobody coming. You're just missing what's really needed here. And youth, why can't you put the youth in there if they're detoxing instead of throwing them in the hall with nothing? And you have new life, you have something for youth that they can come to. Because they got to have somewhere out there, because they're all running the streets. You got kids out there at 3, 4 in the morning doing crime and they're high as heck. And they want to stop. They want to detox, but there's nowhere to take them. There's nowhere to do it. You can only do so much. So as far as what can the county do as far as partnering with different agencies that do outpatient to recognize them, but they got to be qualified. They got to have a good reputation. You can't just say, okay, well we can do this, because no, it doesn't work like that with kids. So it has a lot to do with recognizing the agencies that are in place that are helping kids. There's a whole bunch of agencies here today. What do you do for kids? What groups do you have available for the youth? You have a new place in Upper Lake. Okay, you say the kids, are you doing groups for those kids to how to deal with their parents being addicts? What forgiveness sessions do you offer them to sit with their parents, for their parents to do a ceremony for them, to sit down and tell their kids, you won't get that addict back, I'm going to leave it here. The only person you're going to get to deal with when I come home is me. I'm the only one coming home, not the person that came here. That's a new part that I would like to see 4th Street also offer for these clients that they have in there. I'm in 4th Street also, with culture. There's a traditional lodge that's at 4th Street that I've been running there for 22 years. And they get a different way of looking at healing. Has to do with healing that you give to the adults, but you also tell them, bring your kids with you. So you can sit together and do a healing ceremony. It's a different kind of way of looking at how you take care of yourself. So that's been there for 20 years plus. And the lady who brought that, they're sitting in this room right now. Who brought that to 4th Street while she was working there. And it was a if and and, but I'm pretty persistent. I keep showing up. I tell you, when you say you want Red Road, that means you better know what that means, because I'm not going to quit on you until I go home. That's what that means. I don't quit on nobody.
I think that person's still as passionate today as they were then.
Oh yeah. And so she's sat through a lot of groups that I do every Tuesday there. Every Tuesday, unless I get called out of town. I've been there every Tuesday. And the same way with juveniles, every Thursday. And a lot of other different places. And so as far as services, yeah, I'm right here in Record Valley. That door's open, and I work a lot with kids, I work a lot with adults, I work a lot with different agencies, and I think that there's more of me out there nowadays, and I'm trying to invite them to come here to introduce themselves to what they're doing out there, some new agencies that are coming along and working with. And the other part that we're working on is keeping the community safe by setting up counseling and meetings for 290s. They have somewhere to go, so they're just not thrown out there and treated like crap. They got somewhere they can mentally and physically take care of themselves with counseling. some outpatient and services for them, so they're not thrown to the dogs. That's all.
I have a question for you and the other people working with youth, because you're talking about parents who are addicted, and then it goes down the hill from there. But what about the kids that go off on the wrong the wrong path, and they need help, and their parents don't understand? They're coming from another point of view. Do you find that those parents get in the way of their kids being taken care of?
All the time. They want that to be the code of silence. It doesn't happen in this family. But it does, the kids tell them. I go to middle schools and elementaries, and I teach those kids a class called Common Sense. So I teach them common sense, and then they get it quick. And I tell them, I want you to do one more thing with this for me. They go, what's that, Mr. Martinez? And the little kids, go home, teach your parents. Teach them what you learned today. Teach them common sense, because they're not doing it to you. You didn't even know what it was. I got it, Eric. You've seen how simple it is. But you have all this knowledge, and use that knowledge with some common sense, you'll make a better choice. And I teach that to the addicts, the adults. They don't get it until I go there and show them how it works and how it gets done. And then they go, oh, that was too simple. Yeah, because you were taught to analyze things, analyze things. And you just got to stop looking at it that way. Keep it simple. Very simple. That's all.
Okay.
One of the things that I do want to throw out, which is the bigger part of my heart and fear for our youth, is the drugs today are 10 times more.
Oh, they're really bad.
10 times more lethal.
They're killing them.
10 times more addictive than when I was growing up out of youth. And the way that our youth are being contacted and connected to these substances, which have to do with our cell phones. It has to do with this connection now that any drug dealer will bring it to their door, will bring it to them. And once addicted, once that brain crosses that line, and our youth are in this stimulus stage where they're really investigating and they're addicted that quickly, once we're getting, let's just say at SUDT, they're surrendering to themselves. They're saying they need residential treatment. They're the ones that are understanding that it's something that's already gotten hold of them that they don't know what to do about. And that's why my push for residential treatment in Mendocino County or near Mendocino County, because if they don't meet that criteria for outpatient treatment, we have to be prepared to help these youth. We have to be prepared to help the kids. The families can be a part of that, but once their brain has crossed that line and they're in active addiction, we're losing kids at 21 due to alcoholism. That's uncalled. That's just uncalled.
We actually don't do a lot of, one of the research that we're trying to do right now with our epidemiologists, because it's underreported, right? If anyone looks at our clinical youth assessment, you'll actually see DUIs are high in Mendocino County. Though we always hear they're low, we're actually very high compared to the state average. But we also don't talk a lot about the deaths from alcohol, right? Because we usually don't see it, right? They're long-term deaths, people die, cirrhosis, of course the costs, right? We don't actually look at those people that die from alcohol use because we spend so much time focused on overdose deaths, right? And most people, and they can overdose on alcohol, but it's not where we see the impact of deaths from alcohol. And so we've been working on looking at that from a study perspective within Mendocino County of what is that impact of alcohol in our communities, and what are we actually seeing that ties alcohol to deaths that we're actually seeing by cause of death in the clinic, stuff like that, or seeing the number of people that are currently diagnosed with certain types of diseases that would be related to alcohol use. So we're trying to look at that because we often don't talk about alcohol use as
we're not really looking at that as a cause of death. So that's something we're trying to look at. Jeff, I would say, interesting, every time we talk to a provider, they call Tarzana directly and say, is this program cost effective?
Yeah.
And then Tarzana says no. And so the provider tells me and Jill it's not cost effective.
Right.
Talk to the main provider in the state of California.
Why does everything has to come down to money? And we're getting more, that's a question for everybody in the room. But
Can't answer that, Joe, but it always does. But that is, I think Jill and I approached 2 or 3 different providers to try to say, hey, would you be interested? How could we help you? And they call Tarzana and they've been speaking to them based on the program they operate. And they get scared because Tarzana's in Los Angeles, right? So if they can't staff it, they're concerned about how can we have smaller populations staff at, residential, if someone's in Los Angeles can't staff it. So, and can't stay with a good financial model. So that's kind of the battle we're fighting there. Just hopefully trying to learn what it takes.
So is that the barrier, is that they can't staff it that makes it ineffective?
Financially, it just isn't financially viable to actually staff it at the level and actually make money.
The state regulations, state certification, the tiers and levels just to get a program opened up are 10 times harder than an adult residential program because the mandates, because it's youth, because it's kids involved. I mean, we need to cry at the state levels that they need to take down these barriers for us to get these programs for the kids. I think if we lowered some of those state barriers of what it takes for us to treat our youth, you would find more programs willing to be going into that.
You also find the state's very interesting in that sometimes they want you to treat kids, but they don't have the regulation to open a facility in that type of facility to treat youth. And so then you're battling with the state of like, okay, what are the regs we would use to get certified? And when you certify this type of facility, but you actually don't have the regs for a youth facility. You only have them for an adult facility. It's some of the different areas that we would like to see expansion for youth options.
I've gone to a lot of conferences with our CEO, Tarzana, and part of the way they fund it is with the campus, and they have other programs built on the campus. And so I think those kind of models are intimidating, considering our area community. But I know in Lake County, there was a beneficiary that had that was hospitalized outside of the crisis system, and they were told they couldn't be released from expecting it unless they had an IOP. There's no IOP for you. I think the closest one is Petaluma. And so then the hospital was like, we'll put your job into Petaluma and figure it out for 3 months if you want your kid back. And so I think there's opportunities to look at what services are going to be for Northern California for young people and how you could build a campus that maybe could serve a variety of them that could create a sustainable model. I think
if we can convince Round Valley had money to bring back these facilities where their group home was, their youth group home, and I know they were talking recently at the meeting that we were at, how they have to build grants to fill out behavioral health services. Whether they would look at that facility that they were doing their crisis west, that if they would be willing to look at something, bring something in. We need to have a vote.
Yeah. Go ahead. I just have a member comment, and I'd really like to thank all of the board members and Supervisor Norvell, as well as the service providers for the increased attendance. Part of the challenge of sharing information with the community is that resources within the county for press releases and all of these things are limited. But by you participating in these meetings and by you attending these meetings, you can share this information. And when the RFP goes out from the board, I would encourage each of you to begin talking about that, not only with the service providers that we already know, but other service providers, other community members, your neighbor that moved from Minneapolis might know of something. And so the more that we all talk about the programs that exist and the opportunities and the challenges that we have here, the better our chances are of being able to provide services. So I appreciate everybody's attendance and engagement with this board.
I mean, I don't know how to run the facilities like you guys all do. I love that you're doing it, but if anybody can expand to start including youth more so than we're able to right now, it just seems so awful that it is like a barrier, and these kids, they come and they are now adults and they're already carrying all this with them. And then you get the behavioral health and all that show up later as well.
Just to share with you that my program is looking into a re-entry. I've been doing re-entry forever, but just adults. Now that I've been working with the kids, I'm doing a re-entry with the kids to find them employment and meetings and places that they can go hang out. You know, young guys like you need to scan your brain and see what are they interested in nowadays besides this. And if this is all they got, then it's time to put them on a Zoom meeting that they can come and vent, a safe place for them to talk to you, and work with them. But when you go to county, it's always legal. Legal counsel comes out first. And we better make sure they don't sue us. But here we go. We're offering services. We're not looking for a lawsuit.
We come together sometimes.
You know, it does come together, but when you tell them what you're just going to give them and they agree, then they sign it, boom, boom, it's done. You know, show them for services. So I really believe that you can do a lot of work with this with kids if they know where to go. And I don't know of anybody setting up those kind of things for you to go on and talk to. You know, think about opening and looking at that, because this is what they carry around. They'll beat you up if you would try to take it away from them. And even your own kids will work you over mentally if you take the phone from them. So it's just something to think about, because I know I'm working with the youth that I get out at all, and they come find me on here, and I work with them, outpatient, keep them clean and sober and out of juvenile hall. You know, so it's just something that we can do together. If it's working, then put it out there. Let someone else do it too, and have these kids come and contact you on your meeting time and work, let them work. Find them a job. What's a re-entry? Is there monies available that county can look into from CDCR, or juvenile justice monies that you can set stuff up like that, so county can start running them. And maybe you won't need you can start off with outpatient conference video to where we can find some fundings to open up a place like up in Round Valley where they can reopen that place back up, or other places that we're looking into, because I sit on a board that is getting ready to do this, like what they did over there in Upper Lake, you know, for adults. But I told them we should start with the kids. They got nothing. There's nothing to go to. Nothing. Long time ago, they used to have a place called the Youth Center. You know, teen center. It was called the Teen Center. And all those kids would go there and hang out. They all go there and hang out. You know, there was a whole bunch of different events that they can do to hang out and keep safe. At least their parents knew where they were. You know, where are you going? To Teen Center. Today it's the Arbor, right? Arbor. So that needs to be bigger.
We only have the arbor and kayak right away.
That's what I mean.
That's the downfall.
Bigger expansion. And let's stop leaving out the South Coast over there.
Where's that?
Not getting nothing there. Now they're,
In Coppola with innovative bringing the Boys and Girls Club in.
yeah.
I mean, that was pretty innovative.
And they promoted that to make that happen over in Lake County with the Big Valley as a Boys and Girls Club now. All the other tribes are looking at the same thing to get that going and help each other out. That's what we're doing out there right now, is helping each other out. Having meetings and talking about what's working for our kids. We have a lot of workshops for our kids now that we do as wellness and healing sessions to teach these kids where you can go to and have your ceremonies and have your talks with each other and stop using drugs. Keep no drugs on our res. That's one of the programs that's getting very popular all over the place. Keep drugs off our res. We're cracking down on the members of the adult members that are selling dope on reservations. They either go to rehab and stop doing that, or they lose everything. They lose their home, they're going to lose their revenue, whatever they're eligible for. They don't get it no more. You don't want to stop. You can have your drugs, but you don't get to do it here no more. Go somewhere else. So anyways.
Thank you, Mark.
Thank you.
One thing I was going to add, and I'm sorry, but I wanted to make sure, we talked about it in the Tobacco Coalition a little bit, but I've been working with Supervisor Klein to do a whippets ban on the public health side. And so she's been working on that, and I believe we have our first resolution that will be going to the board at the end of September to move forward with an ordinance for a whippets ban in the county areas in Summer County, which is definitely needed. Some cities have it, I have it. Humboldt County has done one, we have not done one here in Summer County, so it is something that is abused. It creates some severe side effects that sometimes does not go away. And so we do have it being sold for recreational use in different areas of the county. And so we are working on that. So hopefully that, I think she plans to bring that resolution forward at the end of September. We start the process of really looking at
Whip it? Whip it.
It's
Hadn't heard of
bad.
that.
Just like the vapes.
It's something new on top of vapes.
It's not new.
No,
Very
it's not new. But I'm just,
That's old. That's bad. Brain dead.
Yeah, not the severe neurological side effects that people don't realize, and a lot of times they can't see it right away, so, but there's been some long-term side effects that neurologists are really recognizing in people and what do they do to treat it. But we have significant increased use in our county, and I think there are some retailers selling it, and you're not supposed to sell it. It's sold for commercial uses mainly, but we know that there's access to individual medicine.
okay, anything else? Do I hear a motion to adjourn?
Motion to adjourn.
Third. Thank you all for
Thank you,
being
Joe.
here.
Thank you.
We really appreciate you being here.